Hello everyone, my name is Candace Anderson and I am the Senior Project Coordinator at Alliance for Contraception in Cats and Dogs. We are a nonprofit organization dedicated to advancing the development and accessibility of non-surgical fertility control for companion animals. Today I will be providing a brief overview of current and emerging non-surgical fertility control approaches, along with considerations for how these tools may be applied in free-roaming cat and dog populations, both now and in the future. I'd like to start by outlining the two main categories of non-surgical fertility control: sterilants and contraceptives. When we refer to sterilants, we mean products intended to permanently disrupt fertility. Contraceptives, on the other hand, provide temporary disruption of fertility. The currently available products we'll discuss today are contraceptives, but we'll also touch on several products in development whose intended goal is to provide a permanent sterilization. Non-surgical fertility control products come in different mediums, such as oral tablets, compounded liquids, subcutaneous or intramuscular injections, and implants placed beneath the skin. So before we dive in, I want to emphasize that ACC&D fully supports traditional spay and neuter. Our aim is to help advance more tools for humane population management professionals to be able to provide fertility management services that can reach more animals. So why does ACC&D advocate for accessibility and development of non-surgical contraceptives and sterilants? So they generally require fewer resources than surgery. In some cases, fewer personnel may be needed to treat the same amount of animals, and there is no need for surgical equipment or sterile surgical instruments. There's also a potential for some products to be administered by veterinary support staff under veterinarian supervision, which could further expand capacity for care. Non-surgical options are typically minimally invasive or non-invasive, resulting in little to no recovery time. They can reduce or eliminate the need for post-operative monitoring and care. And because of the lack of need for surgical suites and recovery structures, non-surgicals have greater success with field applications and have potential to provide increased accessibility and improved animal welfare to these populations. Now we'll walk through a selection of products that are currently approved in different regions around the world. Please note that this will be a high-level overview. If you would like more detailed information on any specific contraceptive, we encourage you to visit ACC&D's website or reach out to us directly. This diagram illustrates the hypothalamic pituitary gonadal or HPG axis. Disrupting signaling at any point along this pathway can affect a male or female's ability to reproduce. Different contraceptive approaches target different parts of the axis. Some act on the hypothalamus, while others target the pituitary gland or act directly on the ovaries or testes. Depending on where they act, these products can have different effects on the body's reproductive hormones. The first contraceptive we'll discuss is Suprelorin, which is manufactured by Virbac. Suprelorin is a subcutaneous implant that is administered similarly to a microchip. It contains the active ingredient Megestrol Acetate, a gonadotropin-releasing hormone or GnRH agonist. This means that it mimics naturally produced GnRH, which ultimately leads to downregulation of the reproductive hormone pathway and produces a temporary contraceptive effect. Depending on the dosage, the size of the animal, and the age of administration, the contraceptive effect lasts from a minimum of 6 months up to 1 year or longer. Suprelorin is available in more than 50 countries, although approval by species and sex vary depending on the country. It can cause an initial hormone spike in adult males and an estrus flare when used off-label in adult females in the following weeks after administration. Suprelorin has also been used in free-roaming and community dog populations, which we'll discuss in more detail in a few slides. Egalitte is a GnRH vaccine for male and female dogs that stimulates a dog's own immune system to temporarily reduce fertility. The treatment requires 2 initial injections administered about 30 days apart to achieve efficacy, with a booster dose given approximately once a year to maintain the contraceptive effect. To date, the product has been used in owned dogs in Chile, where it is currently approved for use. The company also plans to pursue approval in additional countries and conduct studies evaluating the product's use in free-roaming dog populations. The next product we'll discuss is Megestrol Acetate, or MA. MA is a progestin, which is a class of compounds structurally similar to progesterone that work by mimicking its biological effects, similar to many forms of human oral contraception. MA works by inhibiting ovulation through negative feedback on the pituitary gland, which reduces luteinizing hormone release and thins the endometrial lining of a female animal. In practice, MA can be used as a short-term stopgap option for animals awaiting spay-neuter surgery. There are cases where it has been used in community cat populations while awaiting TNR, and there's also research showing it can be used alongside Suprelorin for a short period to mitigate the estrus flare that can occur following implantation. The next product we'll be covering is a contraceptive for female dogs called Prevestrus, developed by VetCare. Prevestrus is an aromatase inhibitor, which is a type of hormone therapy that blocks the enzyme aromatase, preventing it from producing estrogen. By reducing estrogen levels, it helps control estrus and the associated sexual behaviors in female dogs. This product must be administered orally at the first signs of heat, which is during the proestrus phase of the dog's reproductive cycle, and it is approved for use in the European Union with market availability expected by the end of 2026. Now we will take a look at a few of the non-surgical technologies in development. The first product we will touch on is a single injection estrogen implant for very young male and female puppies and kittens called iSpay and iNeuter, which are being developed by a US-based company called Epavara. When applied in young puppies and kittens, it inhibits the development of the reproductive system by targeting the hypothalamic neuron kisspeptin. Epavara is currently seeking approval for their iSpay products in the US, with approval being targeted for 2029. They're also looking to expand their product research and approval in other countries such as South Korea. We see potential use cases for their product lying in shelter care, in own animal and free-roaming animal care, particularly for the offspring of more socialized animals. I'd also like to highlight several other organizations in this space. This is not an exhaustive list, but these organizations represent some of the exciting ongoing innovation in the development of non-surgicals. Michelson Prize and Grants has committed to funding $50 million in non-surgical fertility research for cats and dogs. They also offer a $25 million prize to researchers who successfully develop a safe and effective sterilant for both male and female cats and dogs. Other groups include the Tarsus Foundation and BioAZ, both of which are developing single injection immunocontraceptive vaccines. The University of Brasilia is exploring approaches using hyperthermic nanoparticle-based injections, and Community is developing an edible contraceptive option for cat population management. Now we'll look at some field application considerations and examples of non-surgical contraception in practice. When considering how to implement a non-surgical fertility control product, whether a currently available contraceptive or a future sterilant, it's important to evaluate several factors. Cost is a key consideration. The cost of any given non-surgical fertility control treatment needs to be looked at comprehensively. Cost per dose is important, but it's not the only factor. As we touched on earlier, non-surgical fertility control generally requires a much smaller team than needed to conduct surgery. It reduces or eliminates the need for expensive equipment, anesthesia, and recovery facilities. It can also be less expensive and easier to transport than surgical equipment. It's also important to consider a product's effects on sexual behaviors. Will the contraceptive of interest suppress mating behaviors and sex hormones, reducing fighting and injuries between males or unwanted behaviors like urine spraying in cats? You might also want to consider how long the product takes to become effective and whether it causes an estrus flare. If so, you can think about ways to mitigate this, such as temporarily separating sexes or administering MA, as discussed previously. Another important consideration is the potential for adverse reactions and side effects. Surgery, as we know, can lead to complications both during and after a procedure. And this can also be true of some non-surgical fertility control options. As mentioned earlier, overuse of a product like MA can lead to health complications. Fortunately, reducing side effects is a core consideration for most of the products in development today, and ensuring that a product is safe to use is one of the key drivers for obtaining regulatory approval for new medications. While permanent sterilants are generally considered the ideal long-term tool for many free-roaming animal programs, temporary contraceptives may still offer value, particularly when integrated with efforts like rabies vaccination campaigns or even in combination with surgery and a management program. Additionally, depending on the average lifespan of an animal population, temporary contraceptives may be manageable in reducing the population. For example, the 9.4 milligram dose of Suprelorin can remain effective for well over a year in some animals, depending on their size and age at the time of administration. And finally, when resources are limited, programs may consider prioritizing animals with the greatest reproductive success or influence on population growth. The ability to identify treated animals is also an important factor when utilizing non-surgicals, and something ACC&D is heavily focused on. In partnership with Georgia Institute of Technology, we are developing an instant, pain-free tattoo system that can be applied to animals that are fully conscious. In addition to this, we are supporting a project that is utilizing photographs and AI to identify and track individual animals. Now we'll look at an example involving Suprelorin. While Suprelorin has been used by multiple organizations working with free-roaming dogs, today we'll focus on its use by the Winnipeg Humane Society in remote regions of Manitoba, Canada. These communities are only accessible by plane, making surgical sterilization especially resource-intensive due to all the personnel and equipment that must be flown in. The dog population consisted primarily of owned or community-owned dogs that were allowed to free roam with shortened lifespans, as is seen with many community dogs. Suprelorin was administered to both male and female dogs, including adult females as off-label use. To help mitigate the temporary hormone spike and estrus flare associated with treatment, owners were asked to keep their dogs indoors for approximately 2 weeks following administration. The program found that Suprelorin required very little equipment and less specialized veterinary infrastructure compared with surgery. As a result, the team was able to treat more dogs than would have been possible through surgical sterilization alone, which contributed to a reduction in the free-roaming dog population. Many community members preferred the ability to remain with their dogs during the procedure, as well as the minimally invasive nature of the implantation process. And some community members became more comfortable with the idea of surgical sterilization after utilizing Suprelorin and opted for spay-neuter for their pets the following year. Overall, the addition of Suprelorin to their program increased comfort and trust and also helped more dogs within the community access basic wellness care. While this is only one example and not a complete overview of field applications, we continue to see strong and growing interest in the use of non-surgical contraceptives for free-roaming animal populations. Thank you very much. Feel free to scan the QR code to access our social media and website and additional information, and I'm happy to take any questions now.